Hello, everyone, and welcome to our channel. Welcome to Nurse Table Talk. Kathy and I are very excited. We have our special first guest. Her name is Sarah, and Sarah is a social worker.
Hi, Sarah.
Hi, thanks for having me.
Oh, thank you for coming and being on our video today. And Kathy is here as well.
Yep. Hi, everybody. Good to see you.
And anyway, so our topic today is what is the role of a social worker? What do they do? And how do they assist others? And where may they work? I will direct this to you, Sarah, and maybe you can tell us a little bit about your background.
Sure. So I've been in the healthcare field for about 10 years now. And when I graduated with my bachelor's degree in sociology, I kind of always had my eye on social work. So sometimes you can get a bachelor's in social work, or you can get a bachelor's in a different degree and then like work towards getting a master's in social work. But from my initial studies and understanding like the human experience and inequality, I've always been very passionate about helping others. So I've had a lot of experience throughout my career with different populations, working with children, foster care, HIV positive populations, working with grief and bereavement, palliative care, in hospital settings, in the government arena, nonprofits, for-profits. There's so many areas within social work that you can kind of learn and be able to help others. So like that's been my blessing throughout my career, is I've been able to really expose myself to a variety of populations in different roles where I can help people in different ways. So that's been super important to me. And then from moving from like the experience of working one-on-one with people in care management roles to then being able to like manage other care managers and like lead programs and be a director of a department in a large health system has just been amazing for me. And I've been able to help people in even a wider scope, which is awesome. So I love social work. It's not always something people understand like all the dynamics about. So I'm glad to just like be here and share with you what I know and kind of, answer some questions, reduce stigmas related to social work, anything.
So Sarah, it's kind of interesting when we talk about helping people and we talk about meeting them where they are and addressing their needs. Can you kind of explain to our viewer sort of like what you do? A lot of times I know in my work history, a lot of times I will suggest a social worker to somebody. Like, I think that this would be something that would be really helpful if you discuss with a social worker. And all of a sudden someone says, no. I don't need a social worker. And so I'm not really sure what they're thinking as far as what a social worker does, but can you explain to people doing it what exactly your role is?
Yeah, social worker is like the profession of social work has been around since like the 19th century, and it started with Jane Addams. And a lot of the social like the benefits we see in society today, with a lot of the equality and like safety nets in society, social workers pioneered those. So social workers very much want to be able to improve the human experience and meeting people where they're at, wherever they're at. So oftentimes people are wondering, well, where are social workers located? Social workers are located wherever people are having like troubles, because they are in the military, they're in schools, they're in government, they're in health systems, they're in doctors' offices. They could be, calling you on the phone from your insurance company. They're really, like you said, meeting people where they're at, and they're able to provide support. So sometimes people think social workers, maybe it's something related to like child protective services or adult protective services. And there may be like, some negative feelings about that. But social workers, they are in those roles, and their job in those roles are to protect people and to provide like safety and support through those transitions that are challenging. But they're in so many other roles to improve like wellness and well-being and like improving access to services. So right now, one of the huge areas you kind of hear people talking about is social determinants of health. Yeah. So that's like one of the primary theories that social workers believe in is like people, the person in their environment. So sometimes in a therapist who's trained in like a traditional like psychological practice. They're really much just working with that person in that session. A social worker is trained when they're working with a person to see them in their environment. So what is your education? What's your neighborhood like? What's your family structure? What are like societal layers that create like more challenges? Like if you're a person of color, what are maybe some more difficulties that you're facing in society, and how do we help address those? If you're a vulnerable population, if you're homeless, like how can we address these situations and make it better? So I think those are some of the ways social workers can empower the person to improve their life.
And Sarah, working with families though too, right? Like in a hospital setting, or a skilled nursing home setting, or home care agencies. Not only are we helping with, or, social workers helping in those roles, but they're also helping families with coping skills, and where to go to get resources, and maybe a starting point, and making it so much easier. You guys are so helpful to the nursing as supports, and we just love social workers. So
We do.
Yeah, like whenever I work with nurses, it's like I'm giving nurses a lot of like my social work like resources, and nurses always love it. They want to like take that information because there aren't enough social workers out there for the needs. So the same with nursing, like in the healthcare field, there are shortages. So we have to help each other. And oftentimes, like sometimes you'll see a nurse who has a lot of social work skills, but being able to navigate the system.
right.
So if you have a barrier, unemployment with coronavirus, I can't tell you how many of my friends and family would say like, well, what happens now? Like, I didn't get a letter, or I'm unemployed. Like they've never had to be in that situation. Helping people navigate through that. Maybe a family member, their loved one is in the hospital, and they're transitioning to a skilled nursing facility or assisted living. What does that process look like? What supports are available? So being able to provide information. And one of the things that I'm proud of, like from the social work field, is I can't tell you how many social workers will like not stop at anything to like help a person like figure out the system. If we can't find a placement or somewhere for you to go when you're leaving the hospital, they'll make phone calls and they'll like problem solve. They have like resources so deep that they won't stop to help the person.
Yeah.
The other interesting thing about social work is they're one of the only helping professions that has like a code of ethics to focus on social justice and advocacy. So you'll see very much that we will kind of like promote certain advocacy efforts. We'll go to Washington to ensure equity in society, and kind of looking out for that whole person. So that's like one of the special pieces about social work too.
Yeah.
That's amazing. I know I've always appreciated the discipline for the level of advocacy. And I've always felt that when people choose not to get involved with the social worker because they maybe don't understand the role, or they think that there will be repercussions to some kind of thing, that they answer a question wrong, if you will, and then there'll be backlash, which isn't the case. But I always feel that when people turn down those services, they're really given they're doing themselves a huge injustice, that they're really missing out on a big part of what could maybe shore up some gaps, or maybe help address a certain level of challenge that they're not able to figure out on their own. So so you guys are just like amazing advocates, amazing patient and family advocates, and so we appreciate you very much. And we really wanted to like give this to our viewers so that they were able to sort of put together some pieces for themselves, and maybe if they're in a situation where they're being offered access to social work, they're not so quick to decline, because you're part of the bed charge, right? I mean, you're free like we are, right?
Yeah. And there's no like in social work, there's no, like, if someone refers you to a social worker, there is no like population that's like, this is good for a social worker. Because when you're facing a challenge, it doesn't matter like what, if you're high social class or low social class, if you have high education or limited education, like a lot of those like factors, sometimes it doesn't matter so much when you're in a difficult situation. Everyone can face a challenge at one time or another. And the social workers will work through that experience with you for that time of your life. And when you no longer like need that extra support, they can step back. So that's the nice thing about social workers. They're with people throughout their like life course. And from the time you're like born, if a new mom is coming home and they're having like maybe issues like buying formula or affording diapers or needing to learn how to breastfeed, social workers can connect you to a nurse or connect you to different community resources all the way through that life experience to like hospice social workers who are in the home and supporting the family and the person like while they're dying. It's just really amazing, similar to nursing, with people throughout their life in these like amazing times, vulnerable times, life transitions, everything.
I know when I worked with patients at times, sometimes maybe they didn't have transportation to their doctor's appointments, or they might have been struggling with their financial costs for some of their medications, or they couldn't afford their co-pays for some of their, multiple doctors visits, because many of them had many doctors. And we would refer them to social workers for, financial support and resources, and that kind of may open doors to other things that they may have been struggling with, or maybe they're having family dynamics of things are bothersome at home and they just don't have anybody to talk to. And so those, Sarah, in addition to what you were saying too, I wanted to bring that up because a lot of our patients have brought those things to our attention as well. Wouldn't you say, Kathy?
Oh, absolutely. I mean,
Yeah.
it runs the gamut of um, financial, emotional, access.
Yes.
It's all of that, and to think that people try to do it on their own is just really, it's upsetting, really. I bet it really is for you, Sarah, when you are able to help people, and then you imagine the same person trying to do all of that on their own without any support. So it's an
It's
invaluable
confusing.
service.
Yeah, healthcare is expensive. Healthcare like is confusing. So being able to be in that experience, even with a master's degree and like being in this field for 10 years, it's complicated. And there's always a new rule, and there's like more digging and learning you have to do. So it's definitely, no one should feel ashamed for having to like need that extra support. And then like viewing like that whole experience the person could be in, so like depression, anxiety, kind of assessing for some of those like clinical situations, and being able to refer them to a psychiatrist for medication, being able to like refer them to a counselor. So social workers are like independent clinicians where they can provide counseling support if they get their master's degree and they become licensed after a 2-year period of time, and they can kind of independently practice. It may vary based on the state, but that's like a great option to be able to provide like that additional like therapy and counseling to patients, in addition to like the basic resources, like being able to afford food, where are local food pantries, how can we afford my medication, how do I get to my doctor. There's so many resources like in community settings with like governmental support programs. They're maybe based on a sliding scale, or they're based on age, so over 65 or over 55, or certain income levels where people may qualify for additional support. And that's why they're there. And if someone doesn't utilize them, then they just kind of sit there. So we want people to be able to utilize those benefits that they qualify for.
Yeah. Yeah. You say that, and I think of all the people who have qualified for Medicaid for a long time, but had no idea how to get the paperwork filled out, had no idea that they were eligible, had no idea what it was for, had no idea that it could be helpful for them. So yeah, it's definitely probably an undertapped resource. And one of the things I wanted to remember to say too was there's a lot of interdisciplinary back and forth and a lot of coordination and communication between a social worker and a physician, the physician and the office and the nurse and the family. So it's not just going out and finding a social worker. It's that person is part of your team. It's part of your care team. And everybody plays in the same sandbox so that the person at the end of it gets what they need ultimately.
Right.
Yeah.
Right.
That's like the best part, is like the team approach.
Yeah.
Right. And Sarah, you mentioned earlier COVID and people's struggles with, maybe depression and isolation and things like that, and coping skills and anxiety and and fear and how to get through these traumatic times that we're in right now. And so social workers, just from what you were saying earlier, I mean, as you mentioned, it's really nice to know that you are out there if people might need help.
So Sarah, how do we help our audience tap into a social worker if after watching this they're thinking of a bunch of things that need to get addressed that they haven't been able to take care of? How would you suggest somebody tap into you, a person like you, for resources?
So there's basically social workers are everywhere in your community. You just have to kind of start looking and start asking. So I would say, starting with your doctor and your primary care physician, if you have one, and seeing if they recommend a social worker. Maybe there's a social worker in your doctor's office and they have like a social worker who's a care manager, or they might recommend you to see a social worker in the community setting, like at a clinic. They also may recommend that you follow up with if you are like over 65, like the area agency on aging. So there's also like community-based social workers, and also like based on like your needs. So say you have, maybe you're facing like some substance abuse issues or substance use, and you're looking for some support to get through that experience or to kind of help you. There are social workers who specialize in that. Maybe you're looking for someone who can help you with like depression or coping skills. There's like one available in your community who has that specialty. So starting with your doctor, having them maybe share what resources are in your local community. Maybe there might be some resources in the clinic themselves. Also your health insurance. Oftentimes, if you're part of a Medicare Advantage plan, they have social workers available. So sometimes calling the customer service, and they might recommend whether they have one available to help you, or they can recommend one that you see. So I think just starting to look and ask those questions. I also noticed you guys did like a session on virtual care. So oftentimes social work now, like they'll do sessions with you virtually. They'll work with you over the phone. If you need the social worker to come out to your home, they're essential workers. They'll come out to your home as part of home care services. So I think just keep asking the questions and doing some searching online, social workers near me, looking up some local nonprofit agencies. They always have social workers providing services and support.
Awesome.
Yeah, that's wonderful. And Sarah, we're so thankful that you were able to fill our viewers in with this today.
We are.
Exciting. It's very exciting. So, I mean, does anybody have any other things that they want to talk about as far as social works? Or, Kathy, I know you and Sarah, do you have anything else you wanted to add that we may have not discussed today?
No, you guys, I just so appreciate that you recognize social work and like elevated social work as a need that you want to share with your viewers. That is huge. It just shows how much you really care about the whole person and helping your viewers like have all their needs met. So kudos to you guys. That's awesome.
We certainly couldn't have done it without you. That's for sure.
Oh, not at all. Not at all.
Yeah. But one other thing that Kathy and I wanted to share with our viewers, I mean, Kathy, do you want me to go ahead and?
Oh, go ahead. Go
Okay,
ahead.
so Kathy and I, well, first of all, we wanted to thank you. I don't know if we
Thank
mentioned
you.
that. Did we mention that earlier,
No, no,
Kathy?
no. We
Oh,
hadn't gotten
okay.
that far. Yeah.
Okay, so Kathy and I, we wanted to thank our viewers for sending in very well-wishing comments and
Thank you so
offering
much.
us support and encouragement on our new channel, Nurse Table Talk. So thank you for that. We certainly appreciate all the support as we are learning and we continue to learn. And we may make mistakes. I'm sure you may hear me stumble on my words a little bit, but that's okay. We're learning. So, but hang in there with us and we'll try to bring you, guests as we did with Sarah today. And Sarah, you're our first one and we're still very excited about that. So, and if anybody has any comments or questions, please let us know. And Kathy, did you want to share anything about your journey so far? Because I know we talked about that in our previous videos.
Well, yes. So I am now a nomad. I am living with my husband and my puppy in my little camper out in the woods in South Carolina.
It's
So
just,
it's kind of an interesting life right now. I
it's a
don't
very,
really, what's that?
it's a very adventuresome spirit you have.
It is. And what's really interesting, it's really interesting, Julie, but I'm learning that, we've met a lot of people in the past couple of weeks who are on their own adventure. And so I think people
Wow.
are kind of at a crossroads in their life, I think, where they're trying to make sense of the world and their needs and trying to make better define what they want. And so I'm happy to say that Daryl and I are not the only people out here in the woods that are doing this. We've met quite a few people.
Well, that's awesome. And each video, that we do, if there's anything you want to share, please share. Our viewers would
Absolutely,
love that.
absolutely.
And,
Today
we certainly
today was kind of interesting, only because I couldn't figure out how to do this and I wanted to make sure I didn't look like I look all the other times, which is in a big flannel jacket and my hair all over the place. So.
Well, you're on a journey and you have a mindset of you got to get certain things done, right?
Yeah,
So,
absolutely, absolutely.
yeah.
So we're house hunting in this beautiful area. The weather's gorgeous, and
Yeah.
we're doing quite well. It's definitely not for everybody, but it's 2020. So are there any rules anymore? I don't really even know. So yeah, so we're doing well. Thank you for asking.
Oh, you're welcome. And thanks to all our viewers for joining us today. We really appreciate all your valuable time. Thanks again, Sarah. We love you. We miss you. And look forward to having you maybe as a guest again. If there's topics that come up that you feel our viewers might be, that you want to share with our YouTube viewers, please let us know. I mean,
Yeah.
That's what we're here for. We want to get the word out.
Yes, definitely.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.